Hi, my name is Liesl Perez. I am the co-founder of Access Integrated Mental Health. I'm also someone who suffers from depression, and I'm currently doing Spravato treatment. I wanted to do this video because I wanted to show people what I bring in my go-to bag when I go into Spravato treatment. So let's get started. The first thing that's, I think, really important for Spravato is actually making sure you have music and also earbuds. Some people actually go to places where they have noise-canceling headsets. Access Integrated Mental Health will always have a noise-canceling headset in the room along with selected playlists that are perfect for ketamine. But some places don't do that. So whatever you do, you're going to have a much better experience if you have your own music source and music that you like that is appropriate for ketamine therapy. I will be linking down below just how you can build your own ketamine playlist and some of the science that's behind that. Another thing that I think is really important for me personally is my weighted blanket. I have a 35-pound weighted blanket that I do bring with me, and I drag this thing around, and I think it's worth it for me personally. Even if you don't have a weighted blanket, just bringing your own blanket can be really helpful. We have some moms that bring their babies' blankets with them because they like the smell and it helps them feel more connected. And if they're suffering from postpartum, that's something that's really important to them. So I think that a weighted blanket is fantastic, or any blanket. We provide blankets at Access Integrated Mental Health that get delivered by a delivery service, so every blanket is fresh, but you may want to bring your own. And so that's something that is up to you. I also bring fuzzy socks and some foot lotion because if you're going to be relaxing for 2 hours, go all the way. I actually kind of treat it a little bit of as a self-care day, and I put in some of my music, and I put on my foot balm, and I put in my fuzzy socks and let it go. I also bring this notebook. It's one of the best times to be journaling. I don't always journal, and I'm going to be honest, I haven't actually even read anything that I wrote in here, but in the moment, sometimes it's really, really nice to be able to write some thoughts down, especially if you're going to be going to therapy the next day or doing ketamine-assisted psychotherapy. It's good to be able to get some of those feelings and thoughts down so you don't forget and you're able to unpack it and integrate it a little bit later. So that's something that you might want to consider. I also bring my own eye mask. A lot of places will have eye masks in the rooms, but you never know. I personally like having my own eye mask that comes with me whenever I go into treatment. I am also somebody who is a barfer. Experience hyperemesis, both pregnancies. I get car sick, even when I'm driving. So this is a thing, and I know this. So they actually give me Zofran to take beforehand. And if you know you're a barfer, I would suggest that you let them know and take Zofran as well. It's really helpful. I also bring my own mints with me. They have candy there. I'm particular, so I bring my own mints and my own candy because the taste of Spravato is bitter and you may need something to just counteract that a little bit. And so that's what I do. I also find that these are really, really special. These are lavender essential oil rollers. We actually give these out as swag for some of the events that we do for therapists. And I will, roll it onto my temples. I'll roll it onto my chest and my wrists and have an essential oil extravaganza while I'm in treatment. And I associate that smell now with relaxation. And so if I'm having kind of a stressful day, just a nice little deep breath of lavender essential oil brings me back into alignment and connection and just feeling better. So I think that's important. Sometimes I haven't needed this yet, but I do have a fidget spinner with me. I have ADHD, and so sometimes I need to be moving or I need to be doing something to keep my mind busy. At the second hour of treatment, I'm generally very coherent and awake, and so I need to do something to pass the time, and so that can be really, really helpful. And then I also bring my own Kleenex. They do have Kleenex in the rooms, but you never know. I just always have these things and I'm always prepared. So that's it. That's what's in our go-to bag. I hope you guys are feeling great and feeling better. And if there's any other suggestions that you think is really great for Spravato treatment, put it in the comments below. Thank you.